Hi, I'm Dr. Thomas Schuler. I'm CEO of the Virginia Spine Institute, and I'm a spinal surgeon. I'm here to talk to you today about your neck. We're very fortunate through the great evolution of spinal healthcare over the past 2 decades to have so many great opportunities to help people. The technology that we have today, the procedures that we have today are so much better than what we used to have, which means we get people back to their lives better, faster, and more fulfilled lives. If we look at a neck, and this is a model of a neck, we can see that there's discs in between the vertebral bodies. And these are discs that allow for the bones to move, so we actually are mobile. And in the back, we have 2 joints called facet joints, which allow for motion. Historically, when people had a disc herniation in the neck, what we would do is go through the front of the neck, remove the disc herniation, and put a piece of bone in, and then fuse it. That fusion would typically have a little plate put on it, where the plate would hold it stiff while it healed. That acts basically like a cast to hold everything tight, and the bone heals. Once the bone heals, the plate's not needed, but we typically would leave it in the neck to avoid another surgery. The technology we have today now is artificial discs, and they're really fascinating because they allow to maintain motion at the disc, and the facet joints in the back still move, so that we're able to remove the painful disc, relieve the pinch on the spinal cord and the nerve, but still maintain motion. Now, not everybody's a candidate for an artificial disc, and we have to be very careful about what cases we have that we give an artificial disc to versus a fusion, and sometimes both. In fact, I'm a patient. I've had my neck operated on, and I have a fusion in my neck and 2 artificial discs above it. That way, the worst level could be treated with the stabilization procedure of a fusion, which produces the best result in that case. But the levels that were still mobile above, we could put an artificial disc in so that I could maintain my motion and I could still operate as a spinal surgeon, allowing me to return to my life. So we're so happy to be able to offer to you these great technologies of cervical fusions, of artificial discs, or a combination, a hybrid. The other exciting thing about the artificial discs is that we've gone through such an evolution of technology. Over the past 10 years, we've gone through 7 different types of implants. In fact, we're on our 7th version now, 7th generation. And it's really, these improvements that have come have been incremental, but they're going to produce vast changes for our patients. We're so excited to be able to offer to you from the Virginia Spine Institute the latest and best technology so that we can get you back to your life.